Exploring the diabetes dataset, an analytical overview. The diabetes dataset provides a comprehensive analysis of various health parameters among females aged 21 to 81. By examining key factors such as pregnancies, glucose levels, blood pressure, skin thickness, insulin levels, BMI, diabetes pedigree function, age, and the outcome of whether an individual has diabetes, we can uncover significant insights into the prevalence and correlates of diabetes in this population. Parameters and their importance. Pregnancies. This parameter represents the number of times an individual has been pregnant. It is essential in understanding the reproductive history and its potential impact on health, particularly diabetes. Glucose, blood glucose level is a critical indicator of diabetes, as the disease is characterized by high blood sugar levels. Blood pressure. This dataset considers blood pressure, an important marker for cardiovascular health. Skin thickness, measured as the thickness of the triceps skin fold, this parameter can provide insights into body fat distribution. Insulin levels help in understanding the body's ability to regulate blood sugar. BMI, body mass index, is a widely used measure to categorize individuals based on their weight relative to their height. Diabetes pedigree function. This function assesses the likelihood of diabetes based on family history, offering a genetic perspective on disease risk. Age is a fundamental demographic factor influencing health outcomes. Outcome. This binary variable indicates whether an individual has diabetes, 1 or not, 0. Chart analyses and observations. Chart 1, blood pressure versus BMI. This chart explores the relationship between blood pressure and BMI across different age groups. The observations are as follows. Lower age equals lower blood pressure. Younger individuals tend to have lower blood pressure, which is a common physiological trend. Elderly with lower BMI equals lower blood pressure. Among older adults, those with a lower BMI also exhibit lower blood pressure, highlighting the importance of maintaining a healthy weight in aging populations. Middle-aged women with higher BMI equals higher blood pressure. Middle-aged women with higher BMI are prone to elevated blood pressure, indicating a potential risk group for hypertension and related complications. Chart 2, correlation between insulin and glucose. This scatter plot examines the relationship between insulin and glucose levels among diabetic and non-diabetic women. Non-diabetic women have lower insulin. Non-diabetic individuals generally exhibit lower insulin levels compared to their diabetic counterparts. Scattered range for diabetic women. Diabetic women show a wider, more scattered range of both insulin and glucose levels, reflecting the metabolic dysregulation characteristic of diabetes. Narrow range for non-diabetic women. Non-diabetic women have a narrower range for both insulin and glucose, indicating more stable metabolic control. Chart 3, heat map of correlations. A heat map provides a visual representation of the correlations between different variables in the dataset. High correlation between age and pregnancies. There is a strong positive correlation between age and the number of pregnancies, likely because older women have had more time to experience multiple pregnancies. Significant correlation between glucose levels and diabetes. High glucose levels are strongly correlated with the presence of diabetes, reaffirming glucose as a key diagnostic criterion. Correlation between glucose and insulin. Glucose levels also correlate significantly with insulin levels, which is expected given insulin's role in glucose regulation. Chart for age distribution histograms. These histograms analyze the distribution of ages within the dataset and among diabetic individuals. Age with frequency. Most individuals aged 20 to 30, the dataset primarily consists of individuals in their 20s and 30s, indicating a younger cohort. Age distribution for diabetic individuals. Most diabetics aged 28 to 45, the highest prevalence of diabetes is observed among individuals aged 28 to 45, suggesting this age group is at a higher risk. Age distribution for diabetic individuals with at least one pregnancy. Late pregnancy equals higher diabetes risk. Women who experienced pregnancies later in life tend to have higher rates of diabetes, implying a link between late pregnancies and increased diabetes risk. Chart 5, BMI histograms. These histograms explore the distribution of BMI across the entire dataset and among diabetic and non-diabetic individuals. BMI and frequency. Most BMIs range from 20 to 45. The majority of the dataset's BMI values fall between 20 and 45, encompassing both normal and overweight categories. BMI for diabetic individuals. BMI ranges from 30 to 45. Diabetic individuals predominantly have BMIs between 30 and 45, indicating that obesity is a significant risk factor for diabetes. BMI for non-diabetic individuals. BMI ranges from 20 to 30. Non-diabetic individuals generally have BMIs between 20 and 30, which fall within the normal to slightly overweight range. Conclusions. The analysis of the diabetes dataset reveals several critical insights into the factors associated with diabetes among women aged 21 to 81. Younger individuals tend to have lower blood pressure, and among the elderly, maintaining a lower BMI is associated with healthier blood pressure levels. Middle-aged women with higher BMIs are particularly at risk for elevated blood pressure, highlighting the importance of weight management. The correlation between insulin and glucose levels varies significantly between diabetic and non-diabetic women, with diabetics showing a wider range, indicative of metabolic instability. The heat map analysis underscores the strong relationships between age and pregnancies, glucose levels and diabetes, and glucose levels and insulin. Age distribution histograms suggest that the majority of the dataset comprises younger individuals, with diabetes being most prevalent among those aged 28 to 45. Notably, women with later pregnancies exhibit higher rates of diabetes, pointing to the potential impact of reproductive factors on diabetes risk. Finally, BMI histograms demonstrate that obesity is a major risk factor for diabetes, as evidenced by the higher BMIs observed among diabetic individuals compared to their non-diabetic counterparts. Non-diabetic individuals tend to have BMIs within the normal range, reinforcing the role of healthy weight in preventing diabetes. Overall, these findings emphasize the multifaceted nature of diabetes risk, involving factors such as age, BMI, reproductive history, and metabolic parameters. Effective diabetes prevention and management strategies must therefore adopt a holistic approach, addressing these various dimensions to reduce the burden of this chronic disease.